Do you or someone you know have an arrhythmia of the heart, or perhaps atrial fibrillation? We approached 3 cardiologists, all experts in the field of electrophysiology, to have a discussion about arrhythmia disorders and how to treat them.
A normal heart rate rhythm is what we're born with. It's the natural pacemaker of the heart. It allows the heart to beat in a synchronous fashion, which is optimal for blood flow.
In general, a patient shouldn't be aware of their heart beating at all. As soon as someone becomes aware of their heart beating, that is considered an irregular rhythm.
When you feel an irregular heartbeat, it's because either a beat occurs early or a beat occurs late. So they are most commonly extra beats that occur in the normal cardiac cycle.
An irregular heart rate can manifest as a sensation that the heart is racing. It could be that a patient is not aware of their heart beating at all. It's simply that they feel dizzy or fatigued, short of breath. There are many manifestations of having an arrhythmia.
The best way really to get a sense of whether something really serious is going on is whether you develop lightheadedness or if you pass out. Those are warning signs that something may be wrong.
On the other hand, it may be very subtle and present slowly over the course of many months until the patient becomes aware of it.
Just because your heartbeat is irregular doesn't mean it's dangerous, and in fact, most irregular heartbeats are not dangerous.
There are very many different types of arrhythmias. There are 7 subtypes. Some of these can be deadly, some of these can be nuisances. Usually the ones that originate from the top of the heart tend to be the more nuisance types. The ones that originate from the bottom of the heart can be the deadly types. Each one is approached differently, each one is taken care of differently, and each one has a different outcome depending on the problem. The most common one that we see is atrial fibrillation, which tends to come from the top of the heart. We see that in about 30% of population over 70.
When a patient experiences an irregular heartbeat, they can see any one of their doctors. They should see the doctor they're most familiar with. So if they have a family practice physician or an internal medicine specialist that they know and trust, that's the place to start. If they don't have an internist or a family physician, certainly any cardiologist and certainly any electrophysiologist, and electrophysiologists are cardiologists with special training in the electrical disorders of the heartbeat. Any one of them can begin the evaluation to determine what the source and what the significance of those irregular heartbeats might be.